If knee pain has been holding you back, whether that's from running or even climbing up the stairs or getting out of a chair, you're not alone. This video is a compilation of my best knee-focused content. How to tell what's really causing your pain, what to do about it, and the key exercises that get you back to moving comfortably and confidently. So get ready to take some notes or just follow along. Let's dive into what your knees have been trying to tell you. Because remember, movement is life, and it's all connected. Knee pain is a common symptom that causes people to go to see their doctor. In fact, 25% of people in the United States report knee pain. Your knee pain may have started with a traumatic incident, but it's not getting better. Or it may have just gradually started over time and it just continues to get worse. You may have been to your doctor who told you to rest and take medication, but that didn't work. So when you went back, they did an x-ray and the doctor said you have knee arthritis, but your pain started suddenly, and you know that knee arthritis develops slowly over time. So is it really the knee arthritis that's causing your pain? And you may have spent way too long resting, only to finally get the pain to go away, go back to your activity, and find out that the pain was still there. Today, we are going to discuss the different tissues that are in your knee so you can understand what tissue is potentially causing your knee pain. Now, to be clear, we're not going to be discussing a whole bunch of exercises and things to do about knee pain, but the goal of this video is to help you understand what's going on with your knee pain as well as what caused it in the first place. But I promise we will do those other videos soon. But first, a public service announcement. This is really important as you're discussing knee pain. You see, the knee is a hinge joint, which is a pretty simple joint. It's not super complex. It doesn't have a lot of different motions. So basically, your knee can straighten and it can bend. It can straighten and it can bend. There's also a little bit of rotation that happens in there, but that's getting a little bit too complicated. If you think about it just as a straight off hinge joint, you'll be better served. And the reason why this is important to consider is the fact that your knee pain may actually be caused by either your foot or your hip, your SI joint, or your low back. You see, if you had a direct injury, you fell on your knee or something like that, then yes, of course, it could be one of these tissues that we're going to discuss in just a minute. However, if your pain came on slowly over time, it may be that there's been some abnormal forces that are going through the knee that are either coming up from the foot or down from the hip. And this is really key, because a lot of people, when they're trying to figure out how to deal with their knee pain or even seeking help for their knee pain, are only having their knee actually looked at. You have to find someone who is going to look at the whole system to understand why these structures that we're about to discuss are painful in the first place. Okay, so what are the structures that could be causing your knee pain? The first tissue we're going to discuss is tendons. These are flexible cord-like structures that connect muscle to bone. And in the knee, the biggest one that people know about is the patellar tendon, which connects the quadricep to the tibia or the shin bone. Many times when people are struggling with a tendonitis, they'll have pain in that area, they'll have swelling in that area. They may even have difficulty bearing weight, such as walking, because they feel decreased stability. The next tissue we're going to talk about is ligaments. Ligaments connect bone to bone, and there's four main ones that we find in the knee. There's the ACL, which many people have heard about, and there's its partner, the PCL. Those are inside the knee joint. Now, on the outside of the joint, you have the MCL, which is the medial collateral ligament, that's on the inside of the knee, and the LCL, which is the lateral collateral ligament, which is on the outside of the knee. These ligaments can get damaged either by an acute injury. You may have heard of soccer players or football players getting ACL tears. But they can also be affected by overuse. So most commonly what I see in the clinic is an MCL injury, and that is that ligament that's on the inside of the knee. And it's because when people are walking, they're putting increased force through that medial knee. And this causes it to kind of stretch out over time and eventually become painful. People who are struggling with a ligament injury often complain about a lack of stability. That may even happen before they have pain. The next tissue we're going to talk about is cartilage. Now, cartilage is like this thin rubbery substance that lines the surface of the joints, and it keeps the bones from jamming down on top of each other. Very important tissue. However, if there's abnormal forces through the cartilage, it can wear out over time, and that is what will lead to arthritis. If you've ever seen an x-ray of a healthy knee joint, there's a lot of space in between the femur, which is the leg bone, and the tibia, which is the shin bone. However, if you've ever seen an arthritic joint, you can see that there's decreased space in there because the cartilage has been worn away and replaced with arthritis. People who are suffering with cartilage issues often have pain that actually increases with rest. You see, when you're up and moving around, you're actually getting some nutrition to the cartilage, and so it doesn't hurt as much. But when you're sitting and resting, it tends to get more aggravated. One thing that a lot of people don't know about is the synovium. So there's this joint capsule that's around, well, every joint, but right now we're talking about the knee joint. And on the inside is this lining that's called the synovium. And this can get irritated, especially when there's something else already within the joint that's irritated. This can lead to warmth, pain, stiffness, swelling, and just the general signs of what you consider inflammation. The tricky thing is that the synovium is irritated usually by something that's going on inside the joint, and it could be because of a systemic issue like rheumatoid arthritis. And the last tissue that we have to discuss in the knee is bones. So you've got that femur, which is that thigh bone. You've got that tibia, which is the shin bone, and you've got the patella, which is the kneecap going over. And you've got that kneecap, which sits on top. Obviously, bones can be subject to issues and they can fracture, which can cause a huge amount of pain. Now, most commonly, if you have a fracture in that, you will be inherently unstable, usually unable to walk or stand, and there will be an excruciating amount of pain. Please, if you believe that your knee pain could potentially be due to a fracture because you have a recent fall or injury, I highly encourage to seek care from a medical professional who can do an x-ray, who can make sure that that's not your problem. And if it is, to treat it appropriately. Now, assuming that you are not struggling with an acute injury issue that you can point to and say, that's what started my knee pain, you may be wondering, but why did it start overall? And what I can tell you most commonly that I see in the clinic is that people have an abnormal gait pattern or an abnormal walking pattern that has been going on for years. And this has put increased stress to the knee that has stretched out the ligaments, that has caused abnormal tension through the tendons and the muscles, that may be starting to develop some arthritic changes because of the compression through the muscles. And it's this cycle that people get into. In that case, what is the root cause? Well, the root cause is the tissue that's actually causing the pain. However, why is that tissue causing pain? Well, it's causing pain because you're not walking normally. So in order to treat that situation, you have to treat not just the root cause, but you have to treat what's causing it in the first place. And this is what I commonly see with patients who are struggling with arthritis, is that the pain has come on over time. They've been told that the cartilage is worn down, but they don't understand why. So what we need to do for them is not only treat the cause of the pain, which is the arthritis, but we need to treat the issue that is leading to the arthritis. You see, many people believe that knee pain is unavoidable with aging, or you may have been led to believe that it's because of activities that you did when you were younger. What I can tell you without a doubt is that the research is super clear. Just because you're older or you like to do high intensity exercise, that does not necessarily increase your risk of knee pain. In fact, the research has shown that that may actually help to decrease your risk of arthritis. It's important to understand not only the root issue of your knee pain or what is causing that knee pain, but why that tissue got irritated in the first place. Again, if you have an acute injury, you probably know, you can point to that event and say that's what caused it. However, However, if you don't, and this is an insidious onset or it came on over time, it's really important to understand why the tissue that is now being painful is causing that problem in the first place, which is why we do a full evaluation when we're in the clinic to understand how all the other tissues are affecting that knee. So we're going to look at your feet as well as your hip, your SI joint, your low back. We may even go further up the spine if we need to understand how all of these forces are collaborating together. And for all of my friends who don't live in the Maple Valley, Washington area, we have an option for you. We have our online health coaching where we will sit down and discuss all of this and your story in more detail to understand what started your knee pain, as well as giving you the next best step on your journey to help reach your goals. Now, if you're looking for some safe exercises to do with your knee pain, I'm going to link a video here for the best exercises to help decrease your knee pain. Are you suffering with knee pain and looking for some things that you can do at home, some massage techniques that will help to decrease the pressure on your knee and eliminate your knee pain? Then you are in the correct place. So I am in the middle of dopey training, which is 4 races over 4 days, totaling 48.6 miles. You'd be shocked to hear that I have some tension in my muscles as well as some knee pain. So I'm going to walk you through the techniques that I use to decrease my knee pain, especially after a long run. Now you may be saying to yourself, Dr. Amy, I am not a runner. Will these techniques work for me? Yes, if you are suffering with knee pain, and particularly if you have tight muscles associated with that knee pain, this video is going to be very helpful for you. You see, when you have tight muscles, it actually causes poor tracking of the knee. It can cause the kneecap to not be able to glide correctly. It can cause compression of the thigh bone on the shin bone, and this can lead to cartilage issues, which is arthritis issues. You can create all these other problems just because of muscle tension. So doing these self-massage techniques can help to decrease the muscle tension, decrease the compression, and decrease your symptoms overall. Because remember, every tissue in your body is designed to heal itself as long as it's moving correctly. If you're suffering with knee pain due to any reason, it may be overuse because you've been running too far, it may be an injury while you were doing your activity, or it could even be arthritis pain. These tips are going to be very helpful to not only help to decrease your pain, but allow your body to heal naturally. All right, first, let's talk about what we're going to use for the massage. Now, you can use your hands, and I will show you some techniques for that. Using the hands are a little bit more difficult when it comes to certain areas of the body, so it's not necessarily my preferred technique when I'm doing self-massage. Obviously, that's what I do for my patients in the clinic, but it's way easier to get leverage when I have them on a table. So the first thing you could try using is a racquetball. Racquetballs are really nice because they're really firm, but they're small enough that they can kind of get into those knotty areas. So I love using a racquetball for self-massage. Now, if you want to up your game a little bit, then what I use at home is the stick. This is an old school technique. They used to be popular probably 20, 30 years ago. I don't know, it was like way back when I started running. They became all the rage and everybody was using a stick before the race and everything like that. You don't commonly see them around as much anymore, but it's still one of my favorite tools, and especially when I'm dealing with the legs because you have those longer muscles and I feel like you can cover a lot of territory pretty quickly. Now, some people will ask me, can I use like one of the massage guns? And sure, that's definitely okay to use as well. If you're going to use a massage gun, I highly recommend the Theragun. I really like the way they have it designed. It's very easy to hold with your wrist, get some good pressure, especially when you're talking about your legs. Some of the other guns have some weird wrist motions that you have to do to get different areas on your legs, so I don't feel like they're as ergonomic, especially when you're dealing with your hands and your wrists. The one thing I am going to ask you not to use is a foam roller. And I know that many people on the interwebs recommend using a foam roller, particularly for your legs. However, I feel like that causes an excessive amount of compression, as well as makes it difficult to keep your spine in a neutral position. We don't want to put our spine in an abnormal position in order to be doing some massage because that could cause other problems later on. So I don't recommend using a foam roller when you're trying to massage your legs. Ready to get started?
First step is the quads. All right, so first off, we're gonna do the quads. Like I said, I like to use the racquetball a lot. So what you can do is just massage it up and down, and I'll kind of find those areas that are really knotty. Let me find a good one in there, like there. And then I'll just kind of roll it down, putting palm pressure. So I put the palm pressure down, especially when I'm doing my quads, because I can get enough pressure, and that feels like I'm getting a good release through there. However, as I mentioned, my favorite thing to use is the stick, and particularly on the quads, because you can get all the way through those long muscles, and you can go up and down and really get through the entire muscle belly into the tendons. Now, with the stick, if you still find that tight area, let me find that same tight area. Yep, right there. You can do a little bit of back and forth if you feel like there's a big knot, or you could do the stick for the entire muscle and then go ahead and use the racquetball for those more specific locations. If you're going to use your hands, then I like to do, again, along that muscle belly and going down like that. Now, if I were going to use my hands, I probably would do that on my skin, but I don't like to use the roller on my skin because it can kind of get a little grabby sometimes. I prefer to do that roller over pants. Everybody's different, so do what works best for you and your body. However, if I was going to do some quad massage with my hands, I probably would do that with shorts on so I could get directly on the skin. Now, whether I'm doing it over clothes or I'm doing it in shorts, I don't like to use lotion when I'm using my hands. I don't do it in the clinic, and I often don't do it when I'm doing my own self-massage. The reason why is I don't want so much that gliding or that surface level contact, but I want to be able to get deeper down in there, which I can do better if I don't have that lotion. Now again, if you feel like more of that gliding motion is more helpful for you as opposed to that deeper motion, and you feel like using lotion is going to be better, that's fine. It's just not my preferred technique, but if it works better for you, then that's what you should do. So now we're going to do the hamstrings. So if I'm going to do the hamstrings, commonly with the ball, I'd either do it in a wider, deeper seat, or you could even do it on the ground. But for right now, I'll show you on this seat here. So I'm going to put the ball underneath my hamstring. So not underneath my butt, but underneath my hamstring. So that's the muscle that goes from my buttocks down to my knee. And like there's a nice spot right there where my hamstring is sitting on top of that ball. Now, obviously this seat is not super deep, so I don't have a lot of motion here, but what I can do is just kind of wiggle that leg back and forth. And let me tell you, that is a super nice trigger point release. So I definitely feel that releasing really well with the racquetball. But again, for the hamstrings, the stick wins again because you can get those nice long muscles. And when you're doing this, you can perch more on the edge of your seat and you can roll back and forth. Again, covering the entire muscle belly and finding those tender spots. And if you find one, there's that one I was just working on right there, you can go back and forth a little bit. Now, I don't know if you can see it from that angle exactly, but the stick does bend just a little bit. Let's see if I can show you here. There's a little bit of bend to it, so it really does help to kind of conform a little bit to the muscle. Now, this bend is fantastic for legs. However, I don't recommend the stick for like the upper body where you have more bony prominences and it doesn't have enough bend to conform to most of the muscles in the upper body. But for the legs, the stick is the winner for me. If you're interested in using your hands for your hamstrings, I like to use my fingers, keeping my thumbs over my quads or over the top of my thigh, more in the front there. And I'll do that again, that long stroke down. Again, if you find a particular area that's tender, you can kind of go back and forth and wiggle over it, but I'll do more of that long type stroke when I'm doing the hamstrings. The next muscle that's up is the adductors. So the adductors are the muscles that are on the inside of your thigh. If you try to do the butterfly stretch, so you're laying on your back, feet together, knees go out, you're actually stretching those adductors. And ladies, for you, I can guarantee you, your adductors are probably tight because most women's are. So it's really important to make sure that we address those adductors. Again, with the ball, you can do a nice long stroke all the way through. Or you can find a particular area that feels tender, trying to find a good spot here. There we go. And then really focus in with the ball. Now, you want to be careful how much pressure you put through here because these adductors are actually more tender than most people realize. Our quads and our hamstrings are usually used to getting pretty beat up, but those adductors can get really tender really quick. So do be careful with how much pressure you're putting through that racquetball. Again, the stick is my favorite, even for the adductors, because it's easy to get here all the way through those adductors without putting too much pressure on my low back, on my hips. I don't have an awkward posture, anything that's going on. You can grab from the other side. If you do this, this will bring a little bit more pressure through there. Yeah, that's getting it pretty well right there. And I'm not having to compromise another area of my low back. So the stick wins for the adductors too. Now, if you want to use your hands for the adductors, I'm not going to use the same hand because I feel like that's difficult to get across my body. I'm going to use the opposite hand. So for right leg, I'm going to use left hand. I'm going to use more of my palm to push down and really stretch through those adductors. Now, I find it harder to get more of that long stroke through the adductors, but what I'll do is kind of grab the adductor and stretch it down. Grab the adductor and stretch it down. Now again, if you find those really tender spots, so there's a good one right there. Then I'm going to use some fingers, particularly on that trigger point type of area. Some people like to put the fingers on the trigger point and then shorten the muscle. So for adductors, that's going to be bringing that knee towards that other knee, and then that will help to shorten it. That can help to release that trigger point a little bit easier. So it would be fingers for the trigger point or the really hyper irritable part of the muscle, but I prefer to use the palm of my opposite hand to really get through that muscle belly. So we did the front, we did the back, we did the inside. Do we do the outside? Now here is the controversial question of what do you do about your IT band? Many people are aware that their IT band, that thick piece of fascia, is on the outside of their leg. And when you massage it, it tends to get really irritated. A lot of people really like to use that foam roller on that IT band. I find that that's a lot of pain without a lot of gain. So what will I do for the IT band? Well, if you've watched any of my other videos, you know that I don't like to treat the IT band directly. Instead, I like to treat the gluteus medius, which is the muscle that's up at the top of the hip that the IT band originates from. You see, the muscles have a lot of blood supply. And when you have a lot of blood supply, that can bring the healing nutrients that are needed. As opposed to the IT band, which is fascia, which does not have great direct blood supply. So if you do something like a foam roller, that does create some trauma and maybe even some stretch, but that stretch usually comes at the cost of having damage. And if you don't have great blood supply, then it's not going to heal, which will leave you in a chronic state of iliotibial band syndrome. That's why I like to treat the gluteus medius. Now, to do this one, the stick in general will not win for me because now we're talking about more of a bony area and a smaller muscle. So I like to use the racquetball on the wall. Okay, so for the gluteus medius, you're going to take your ball and you're going to put it over that gluteus medius. So this is my hip bone, so my hand is on my hip bone. The gluteus medius is right underneath that hip bone. So top of the hip bone, bottom of the hip bone, boom, right there is your gluteus medius. Now, if you go further down, you'll feel another bump. That's part of your femur. We're not trying to massage part of your femur because that's not going to feel good either. So you're going in between. Here's the top of your iliac crest or your hip bone and the bottom. You're going to go from the bottom of the iliac crest or your hip bone to the top of the femur. It's actually the greater trochanter, but we're just going to call it the femur for today. You're staying in this area. So you're going to take the racquetball, you're going to put it in a spot, and you can kind of roll it around a little bit with your hands so you can find that spot. There's usually nice trigger points in your gluteus medius. Then once you've found one, you're going to put that on the wall. And then you can kind of lean into it. Now notice my feet are not really far away. That's a lot of pressure, ow, and that's really, really painful. I don't like that at all. So my feet are 6 inches from the wall, but I'm gonna lean into that just a little bit, find that trigger point again, and then I'm just gonna kind of do a little wiggle. little back and forth. You can also do a little up and down, like a little baby squat kind of thing, but I like to do a little wiggle back and forth, and man, that is just really getting that trigger point. Now, I will say in the gluteus medius, trigger points tend to be pretty significant, and it usually takes a minute or two to get them to melt. And how you know that they've melted is that it doesn't feel as sharp. So many people ask me, like, how long should I do it for? Well, you should do it until it melts. How do you know if it melts? It's not quite as sharp. It will usually turn from sharp pain to kind of a bruise type pain. Then at that point, you know that the trigger point has melted. You've got blood flow to that area. Then we want to leave it alone for a little bit and let it heal. Okay, now when we're talking about knee pain, we don't want to forget about the calf, because that gastrocnemius, or that calf muscle, does cross that knee joint. So it can also be causing some of that pain. So if you want to use the racquetball for this one, you're gonna, again, flat palm it, because I feel like that's gonna be easier, and then you can roll it over the gastroc until, I don't know if you guys can see it, but it's actually like flipping over there. There's a nice big trigger point right there. And then I'm gonna apply a little bit of pressure and do some little circles. Again, you can do the back and forth, you can do the up and down. For me, I feel like the little circles are working really well here, so that's what I'm gonna do until that trigger point melts. However, for me, the stick still wins when we're doing the calf, because again, these are nice long muscles and I feel like I can cover more ground quicker. So I'm gonna bring it behind here and just go up and down along that muscle belly until I find another nice trigger point, and then I can stay up in there and just go back and forth like that. Now, if you want to use your hands with this one, what I do tend to do is have thumbs on the back, fingers on the front, and again, I'll run my thumbs down the back of my calf. Oh, that's a nice spot right there, right over my Achilles tendon. Oh yeah, that's definitely a good one. And then you can kind of move over and run your thumbs down there. If you find that nice trigger point, again, I like to use the fingers and just find some pressure. There we go. This can be a little bit more helpful because sometimes calves have trigger points that are kind of on the front part of the calf, whereas the racquetball has to go through the calf to get to that. Sometimes the fingers can kind of dig in a little bit. If you feel like you're not completely able to get it with the racquetball, you might try coming at it from more the front part of the calf and dig in there a little bit. That's a really nice spot right there. And again, I'm going to make sure that that area has enough pressure until that trigger point melts, and then I'll go ahead and move on to another area. Now, with your foot elevated on top of something, one, it makes it easier for your back to get to it, which is one reason why I like to do it, so you don't have to be bending all the way over. But the other thing too is that puts that calf in an already shortened position, so you're already ready for that trigger point release. All right, so there it is. If you want to eliminate your knee pain, how you can do some self-massage using multiple different tools. Try the different ones, see which ones work best for you. As you saw, the stick is generally my favorite, especially when it comes to legs. And I'm going to drop a link below if you're interested in checking it out. If you've been looking for a massage gun, I cannot recommend the Theragun high enough. Again, the ergonomic design I feel like makes it much easier. Plus the Theragun is easier to use on things like the upper extremities where I wouldn't use the stick. So I'm going to drop a link in the comments below. But now it's over to you. What is your favorite tool to use to massage your legs in particular, and why is that one your favorite? And yes, I understand if it's a foam roller, you're going to have comments about what I said in here. Again, my personal experience is the foam roller causes more pain than it actually benefits, but I'd love to hear your feedback. If you are suffering with knee pain and you've already been to see the doctor, they may have recommended that you either get a cortisone shot or a PRP injection. In fact, they may have even offered you both options, and you're trying to decide which one is best for you. Today, we are going to unpack cortisone versus PRP for knee pain. Nearly 20 million Americans suffer with knee pain, and this can go on for a long period of time if the correct treatment is not administered. The choice of treatment can significantly impact your recovery. So in this video, we're going to delve into two of the most recommended choices for knee pain: cortisone injection versus PRP injection. helping you to understand which may be best for your situation. Knee pain can be debilitating, and many people struggle with knowing what the right treatment option is for them that will provide them with the most relief and healing. First up, we're going to discuss cortisone injections. The cortisone injections have been around way longer than the PRP. It delivers steroids directly to the affected area. The steroids can help to decrease inflammation either in the joint, in the tendons, or in the ligaments surrounding the knee joint. It can help deal with arthritis, tendonitis, and bursitis. Arthritis is inflammation in the joint. Tendonitis is inflammation in the tendon. And I bet you already guessed that bursitis is inflammation in the bursa. But what is the bursa? The bursa is a fluid-filled sac that helps to decrease the rubbing of the tendons on the bone. So you'll find them in those bony places in your body, which means you'll definitely find them in your knee. So the cortisone injection is a steroid. Cortisone is a steroid that's directly inserted via a needle into the affected tissue. They may go into the knee joint to deal with arthritis. They may go into the tendon to deal with the tendonitis, or directly into the bursa if they feel that your pain is coming from a bursitis. And usually before they inject the big needle, they have a smaller one that provides a local anesthetic, so it doesn't hurt too much when you actually get that big needle stuck in. Now, cortisone may take 7 to 10 days to take full effect because the idea is that the cortisone decreases the inflammation. It doesn't do it all at once, though. It's kind of like Pac-Man going along and eating, just the different dots, right? So it can take a while for it to take full effect, but usually doctors recommend 7 to 10 days to see the full effect of your cortisone injection. Now, how long do the effects last? It can be from weeks to months. But the truth of the matter is, if you have dealt with the issue that caused the inflammation in the first place, the cortisone injection can last forever. It can help be the thing that bumps you over to decrease that inflammation and let all the other things you're doing, the therapy, the movement, the exercises, to really take effect. So I had a patient who had a cortisone injection directly to their knee because at the time, their primary pain was coming from the knee. Now, here's the thing. The knee pain had led their hip to not functioning correctly, and it was actually causing problems further up the chain. Now, luckily, we already knew this because we had already done the evaluation. So when the patient had the injection into the knee joint, it got rid of the knee pain, but it caused hip pain. And my patient was very discouraged because, of course, one thing was gone, but it just brought through another problem. So what I had to tell her is that pain inhibits pain. And so she was actually having the knee pain, but it was more than the hip pain she was having at that time. So the cortisone injection worked in that it eliminated the knee pain. However, then the hip pain was able to become more present or increased awareness of it on her part. This does not mean that the cortisone injection caused her hip pain, but it did cause her to be aware of her hip pain. And that's the benefit of working with a specialist before you have the injection, because they can help you navigate these things afterwards. So if you have some unusual symptoms that you weren't expecting, they can help you understand, was that symptom really to be expected based on your whole holistic history? Next up is the PRP injection, or plasma-rich protein. What the doctor is going to do for this one is they're actually going to draw some of your blood out. They're going to put it in a spinning machine called a centrifuge, and they're going to take out all of the plasma from your blood. They're then going to take that plasma and directly inject it into the area or the tissue that is in lesion. So what does that do? Well, it provides the plasma or the healing cells directly to the tissue that is having a problem, which is fantastic because then you actually get a bump on your body being able to heal itself. PRP injections are commonly used for things like arthritis, tendonitis, or ligament issues. And the great thing is, since it's your own blood, there's very limited side effects. The downside compared to the cortisone injection is that it does potentially take longer to see the effects. You see, the cortisone is actually going in and decreasing the inflammation. That is what cortisone does. The PRP is to boost your body cells and their ability to heal, which means it can take a couple of months to actually see the full benefits of the injection. But the great thing is that injecting your own blood in there actually leads to complete healing of the tissue, which means this problem may never come back again. So I have an opposite story of a PRP injection this time from my cortisone injection earlier. So you remember earlier I talked about my patient who had a cortisone injection in their knee and started having hip pain. Well, this time I'm going to talk about a patient who actually had a tear in her labrum up in her hip that she had a PRP injection to. Now, the PRP injection took a while to be able to heal the labrum in the hip, but she was actually scheduled for a total knee replacement because the hip problem had actually caused so much knee pain, and the doctor saw arthritis on the x-ray and thought that the knee needed to be replaced in order to eliminate the pain. I thought that the problem was coming from the hip and the fact that she couldn't move correctly, which was putting abnormal stress on the knee, which was aggravating the arthritis that was already there. As it turns out, I was right, because when the patient had a PRP injection and that hip labrum healed, she was actually able to move correctly, which decreased stress on the knee. She was even able to get back to exercises that she enjoyed doing, like biking and walking and swimming, which of course, all of those activities are fantastic in keeping your knee joint happy and healthy. So here's the thing. A cortisone injection or a PRP injection can be a helpful part of your healing process. However, you need to be working with a specialist who can get to the root cause of your problem and get your body moving correctly, no matter if you have a cortisone injection or a PRP injection. Now, many people ask me which one I prefer, and I will say that I definitely prefer the PRP injection in general. The reason why is it's using your own blood cells, your own plasma, in order to be able to help your body heal. So it's very in line with the way I treat and my belief that every tissue in your body is designed to heal itself as long as it's moving correctly. Here is the caveat to that though. If you have a knee joint that is really, really swollen and really puffy and it makes it difficult to move because you're so swollen, the PRP injection may actually be aggravating to your knee joint. In this case, if you have a very swollen knee joint, it may be more helpful to get a cortisone injection because that will help to decrease the inflammation. When you decrease the inflammation, that's going to allow you to have more normal movement, which is going to allow you to do the things you need to do in order to heal. So the truth of the matter is, it really depends on you and what's going on with your body. But a general guideline, I prefer the PRP in general more than the cortisone because the cortisone is a medication. However, medications have their time and place, and if you have a really swollen knee joint, the cortisone injection is going to be better to help to decrease that swelling. Now, I would love for you to drop your comments below, specifically if you have had a cortisone injection or if you have had a PRP injection. If you would drop a comment, let us know which one you had, why you decided to have it in the first place, and how it worked for you. That would help other people who are trying to make a decision between a cortisone injection and a PRP injection. I have a secret to share with you today. Your knee pain may not be because of a knee problem. I know, you've been searching all over YouTube looking for answers for your knee pain. However, the problem may not actually be in your knee. It might actually be in your ankle or your hip. And if that sounds absolutely crazy to you, I'm going to encourage you to stick around because we're going to explain the kinetic chain of the lower extremity, which is your leg, and how it's all connected, which is one of our favorite statements around here. It's all connected because the hip affects the knee as well as the ankle affecting the knee. And most knee pain problems are actually because of a problem or a limitation in motion in another area of the body. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and we are empowering women with changing bodies to move pain-free. Now, a lot of women come into my clinic and they are reporting that they have knee pain. And when we're getting ready to do the evaluation, I explain to them, we're going to look at everything from the low back down. That includes the low back, the SI joint, the hip, the knee, the foot. We're going to look at it all, how you're walking, how you're moving, and how everything is functioning together. Women who are new to my world, they are very confused about why we are doing this. And that's because they just don't know yet how it's all connected. Let me explain. The knee joint is a basic hinge joint. It really only does two things. You can straighten your leg and you can bend your knee. Straighten and bend. And it's a basic hinge joint. There's not a lot going on and it's not super complex. But the forces from the ground go up through the foot and get absorbed by the knee, as well as gravity pressing down through our spine and through our hip also meet at our knee. So a lot of women who are suffering with knee pain, and this can include things like meniscus tears, knee osteoarthritis, patellofemoral pain syndrome, are actually dealing with knee joint issues that are coming from somewhere else. Now, I'm not saying that the knee joint is not the root of the pain. I'm saying that the knee joint may not be the root of the issue. Let me give you an example. If your hips are tight, it's going to be difficult for your knee joint to move correctly because that tightness is going to go down the outside of your hip, down through your knee. It's going to pull that kneecap off to the side. The kneecap is not going to be able to move in the groove that it's supposed to move in. It's going to jump out of the groove, which is going to cause pain problems, which could lead to osteoarthritis. If you want to understand a little bit more about osteoarthritis, I'm going to have you go ahead and check out this video over here. Similarly, you can have issues that come up through the foot or the ankle. You see, the ankle is a little bit more of a complicated joint. So you have the calcaneus, which is your heel bone. That's the bone that you walk around on. On top of that, you have the talus, and that bone is really important because it transmits all the force up through the tibia and the fibula, which are the shin bones. So they say like the talus moves like a boat on the water on top of the calcaneus to be able to transmit those forces up through the body. Now, here's the thing. The tibia and the fibula, those shin bones, they're part of the knee joint too. So if you're having a problem that you can't move your foot correctly, either flexing it or extending it, then chances are good that's going to show up as a problem up in your knee because it's the same bone that's in your ankle that's up in your knee. So many women I see who are having issues, particularly with patellofemoral pain syndrome or pain behind their kneecap. I'm going to link a video here to learn more about that. But what is actually happening is their foot is not interacting with the ground correctly, and it's actually causing the tibia and the fibula to move incorrectly, which is what's producing that knee pain. So in order to eliminate the knee pain, we actually need to work on the ankle or the hip or the SI joint or even the low back. Another one that I very commonly see, particularly in women, so our hips are wider than our knees. So if the outside of your hips start to become weak, what will happen is that your knee will actually dive in while you're walking, while you're running, or while you're doing regular everyday activities. This causes increased force on the inside of the knee while it causes increased compression on the outside of the knee. And that can lead to all kinds of problems. And it's a little bit challenging because it's all connected. So how do you know if it's your foot that's causing your knee pain or your hip that's causing your knee pain? I'm going to have you try a couple simple tests at home. It will be helpful if you can do them in front of a full-length mirror, because then you're going to be able to see how you're moving. So the first thing I want you to do is I want you to stand in front of that full-length mirror. I want you to put your hands on your hips, and I want you to rise up on your toes. So you're going to do, we call it a heel raise. You're going to lift your heels off the ground and rise up onto your toes. Now, while you do that, I want you to see how your feet are moving while you're doing that motion. And what I want you to look for is, are they moving the same? Particularly if you have knee pain on one side, chances are that one foot may be moving differently than the other. The next test I want you to do, also in the full-length mirror, I want you to put your feet hip-width apart, put your knees hip-width apart, put your hands back on your hips, and I want you to sit back as if you're going to sit in a chair. This is called a sit-back squat. Now, as you do that, what I want you to do is watch your knees again and see if they dive in towards each other. It may be that both of them dive in or only one dives in. Now, if you're able to do that test and you don't see either knee diving towards each other and there's no pain with it, then you can progress to the next test, which is called a single leg squat. You're going to do the same motion, but you're going to do it on only one foot this time. So you're going to start with the pain-free knee. You're going to lift the other foot off the ground, and then you're going to squat down as if you're sitting in a chair. You're going to be watching to see what that knee does. Does it dive towards the other side? Do you have decreased balance? Like maybe you can't even do it because you're like, oh, my balance is not great. Then it would be a good thing to work on balance. Or you may not have the strength to be able to do that. Now, is that strength important? It depends what you want to do in your daily life. But if you do motions that involve squatting, such as picking up your child or grandchild, or gardening, or being able to get up and down off of a ladder, then you want to make sure that you do have that single leg strength. So by doing those 2 and maybe 3 tests, if you can tolerate it. So again, the first one is rising up on your toes. The second one is that sit back squat with both feet. If that is okay, your knee is in normal alignment and you feel no pain while you're doing that, then you can try to do the single leg squat and see what happens with your knee then. That will give you the information as to if your knee pain could be coming from either your foot or your hip. And so what do you do about that? Now that you can know what to look for, so you can either look for foot strengthening exercises to help improve either your balance or your strength or your motion, or hip strengthening exercises to be able to also improve your balance or your strength or your motion. But now you know where the root of the problem really is. And so working on that issue will help to decrease your knee pain. And I've seen hundreds of women in the clinic who have been dealing with knee pain, who have these abnormal biomechanics. But the example I'm going to give you today is of myself. So 6 weeks ago, I suffered a lateral ankle sprain. So I sprained the outside of my ankle. I went through a whole rehab process, and we can link those videos here if you want to understand more about that. However, as I started returning to running, I also needed to take a trip on an airplane. Now, the problem with the trip on the airplane is that it causes increased swelling in my legs. Even on a good day, it causes increased swelling in my legs. And yes, I do wear compression socks, but I still suffer with this problem. You add an ankle sprain on top of that, and the problem is always going to compound. But I still wanted to do my return to running progression because I have a race coming up and I need to get training for it. And so I had been running regularly on the treadmill for now to get my mileage up. So of course, as soon as I got to the conference, I hit the treadmill to do my 2 miles, which is what I was scheduled for that day. And the great thing is that I was in a gym that had a mirror right in front of the treadmill. So I was actually able to watch what was happening with my feet and knees while I was running. What was happening was that my right knee, which is the non-sprained ankle, was tracking correctly and I had good motion. My left knee, however, kept diving in every time I took a step on it, which means in this case that my ankle is not moving correctly at this point and it's causing increased force into my knee. Now, I'm just doing my return to running progression, so I do not have knee pain yet, but I can guarantee you if I went all the way through my training program, which is going to be 4 months long at this point, I would probably have knee pain by the end of it. I'm also not getting any younger at this point. So what did I do about it? Luckily, I was at a conference that was full of physical therapists, and so I had somebody work on my ankle. I used some shockwave on it to decrease the swelling, as well as had some manual work on it to get the foot moving better. And I have returned to my exercises to increase the strength, increase the balance, and get back on the elliptical to decrease the force through the ankle while I'm working on my cardiovascular fitness. So sometimes, friends, you have to take a step back in order to move forwards. But it's important to make sure that you understand why you're taking the steps you're doing, and it's important to understand why you're taking the steps you are. So if you have been suffering with this knee pain for too long and you are looking for some help in understanding what your next best steps are, we do offer online health coaching. This is great for people who have been stuck. Maybe they've watched all the YouTube videos, they haven't helped at this point, and they need more personal advice. If you're interested in learning more, I'm going to have you reach out to concierge, CONCIERGE at pt4eb.com. And if you want to learn more about a specific knee diagnosis, I'm going to have you check out this video over here. Is knee osteoarthritis slowing you down? Maybe you've had pain in your knee, you went and got an x-ray or an MRI from the doctor, and now the surgeon is recommending surgery, but you're not sure if you actually want to do that or not, and you're trying to figure out what other options are available to help you with knee osteoarthritis. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and we are empowering women with changing bodies to move pain-free. And that includes women with osteoarthritis in their knees. Let me tell you a story to explain why this is so very important to me. I had a patient who had come in after a fall on both her knees. So she was hiking, she tripped, and she fell straight on both knees. And she could no longer walk, she could no longer hike. I mean, even doing housework was really difficult for her. So, of course, logically, she went to the doctor. The doctor did some x-rays and said that you have knee osteoarthritis, and the only way to fix this problem is to have knee surgery. Now, here's the thing. She had the osteoarthritis before she fell on her knees. I'm going to explain more about that in this video. We were able to get her back to walking, back to hiking, and of course doing all of her day-to-day activities pain-free, including painting her entire house. Did we fix the knee osteoarthritis? Well, we didn't change what was happening in the joint, but we did change the pain and her quality of life. So we'll talk about what is knee osteoarthritis, why it might be causing you pain, as well as some simple things you can do, including what I did with this patient to help her get pain-free with her knee osteoarthritis. All right, first step, what is knee osteoarthritis? Knee osteoarthritis is when there's abnormal bony formation within the knee joint. You see, what happens is there's cartilage, which is like this spongy cushion that is in all knee joints, and it helps to protect the bones so that they can move easily or glide over each other instead of crunching on each other. What can happen is if you're moving incorrectly, this can cause the cartilage in the joint to be damaged. As the body tries to heal that, it will lay down bone in that area instead of cartilage. So instead of that soft, squishy substance, now you have bone, which is a much harder surface. Over time, if you get enough of that bone forming, you will end up with knee osteoarthritis. Now, here's the thing. The research is super clear that if you're over the age of 30, chances are good you have some knee osteoarthritis. But just because it's common doesn't mean it's normal. You see, the cartilage in every single joint, and especially the knee joint, is designed to be able to heal itself as long as it's moving correctly. And we'll get to what does moving correctly look later on in this video. So what are the common symptoms of knee osteoarthritis? Most commonly, it is a dull, achy pain in the knees that increases after activity. So you see, as you're moving, it's helping to decrease the inflammation in the short term because it's pumping that inflammation out of the joint. However, since your movement pattern is probably not correct, then a couple of hours after the activity, you will notice a dull, achy type of pain. Occasionally, as it progresses, you will get a sharp pain actually while you're walking, but most commonly it starts as a dull, achy pain. If it starts as a sharp pain, most likely that's more of a nerve issue in the nerves that are surrounding the knee joint. Now, a lot of people, before they even have any kind of pain, have like a crunching or grinding sound in the joint. This is most noticeable when you're doing things like going upstairs or doing squats, and you have this grindy type of noise. Chances are good you have some form of mild knee osteoarthritis at this point. Now, if you're saying that's me, stay tuned because we're going to talk about what you should be doing at this point to keep your knee osteoarthritis from progressing. Now, the most common misconception that I see is that people go to the doctor, get an x-ray, are told it's bone on bone, and the only option is to have surgery. So the patient I talked about earlier, that's exactly what she was told. It's bone on bone, and there's no way to heal this unless you have surgery. So my question to her was, what does healing look like for you? You see, the truth of the matter is I cannot fix knee osteoarthritis. It is an abnormal bony formation, so I can't necessarily change that. But I can change the pain perception by decreasing the inflammation in the joint. So if your definition of healing is being able to get back to your regularly scheduled programming, then there are things that can be done for that. If you actually want to fix the knee osteoarthritis itself and feel that's the only answer for you, then yes, surgery would be the only answer because there's nothing that you can do to actually fix knee osteoarthritis. You can stop it from progressing. You can get it to be pain-free, but you're not going to actually change what's happening in the joint. So what are the key strategies that you need to implement to stop the progression of knee osteoarthritis and get to moving pain-free? To answer that, we want to consider how did this knee osteoarthritis start in the first place? Knee osteoarthritis most commonly starts for one of two reasons. One, the knee joint is not moving correctly, or two, there's not enough strength in the knee joint to support the activities that you want to do, which means the solution is relatively simple in that we want to improve the movement in the joint so that this doesn't progress any further. And we want to strengthen that joint to keep the knee osteoarthritis from progressing moving forward. Now, for some people, and most of the people I see in the clinic, their movement pattern has become so abnormal that they're not actually able to fix it on their own. That's when you need the help of a really good manual physical therapist to help you restore that normal movement pattern, because every tissue in your body is designed to heal as long as it's moving correctly. But I want to give you some ideas of things that you can be using on your own, or even things that you could talk to your physical therapist about. The first thing would be, what is the best cardiovascular exercise for knee osteoarthritis? So my favorite cardio exercise for knee osteoarthritis is swimming. You are going to have that decreased weight bearing, which decreases the force on the knee, so you're not going to be progressing any knee osteoarthritis, and you get that normal movement of the knee through a small range of motion while you're swimming. Now that's important because you don't want to be putting any abnormal forces through the knee. So swimming is a great option to help decrease the force as well as improve the motion in the knee. My second favorite cardiovascular exercise for people who have knee osteoarthritis is biking. Even a stationary bike counts because what happens is you're able to move that knee through a greater range of motion, so you have more motion in your knee as you're riding the bike, which allows for normal lubrication of that knee joint and will help keep the cartilage from getting further degenerated. Now, if swimming's not for you, maybe you don't have access to a bike, then my third favorite cardiovascular exercise for knee osteoarthritis is using the elliptical. You see, you are on your feet at this point, so you do have that weight bearing or that gravity pushing down through the top of your head. However, your feet are planted on the pedals as you're moving forward, which means you get a lot of motion through the ankle and through the knee, which helps with gliding, and that will allow the cartilage to get more plump, so you have decreased symptoms from your knee osteoarthritis. Now, how do you increase strength in your legs to help decrease the symptoms of knee osteoarthritis? Well, most people will feel like I need to work on my quads, which are the big muscles in the front of the thigh, because those muscles cross the knee joint. And I understand that makes sense. However, most people who have knee osteoarthritis are actually quad dominant, which means they overuse their quads and they underutilize their hamstrings, the muscles on the back of the thigh, and their glutes, which are the muscles in your butt. So if you're looking for strengthening exercises to help with your knee osteoarthritis, I'm going to recommend that you actually start working on your glutes first. Depending on where you are on your journey, you can start with things like glute squeezes while you're sitting or while you're lying down. You can do exercises like bridges to help really activate those glutes. And as they get stronger, you can do things like squats where you're going to be getting more of that glute activation. And squats are great for the glutes, and I absolutely love them. However, most people with knee osteoarthritis cannot do a squat correctly because they have knee pain. So you need to focus on that cardiovascular exercise to get the knee joint moving more correctly so that you can tolerate a higher level activity such as a squat pain-free. Because any exercise that you do that increases your pain is not going to help with healing. You see, when you're having pain, when you're exercise, and I'm talking about a reproduction of your pain. Yes, if you're doing a high-level strengthening exercise, there can be some soreness that comes along with this, but I'm talking about a reproduction of your symptoms. If you are having that, then what happens is it actually causes the muscles to tighten. Most commonly, in this case, it will cause the quads to tighten. And if your quads tighten, that increases the compression in the knee joint, which is exactly what we do not want, because that's what got us here in the first place. Now, if you're looking for some exercises that you can do for knee osteoarthritis, I'm going to recommend you check out this video over here. It's the video that has all the exercises that I did to increase my hip strength as I was preparing for the Dopey 2025. And all of them will be effective in helping to decrease your symptoms of your knee osteoarthritis, but they may not all be tolerated at this point. So you have to do the exercises that you can tolerate without increasing your pain. So, how does physical therapy help to decrease knee osteoarthritis? So, a physical therapist is going to look at your movement pattern and do what is required to change that, as well as put you through a monitored program to help improve your cardiovascular fitness, as well as increase the strength. So, they'll do things like testing your strength in your legs, finding out if you're quad dominant, helping you to be able to activate your glutes and decrease your symptoms over time. The goal of physical therapy really in this case is going to be giving you that program that you're going to continue for the long term. Now, if you see a manual physical therapist, such as myself, they're also going to be focused on decreasing your pain and inflammation while you're in the clinic. Because let's face it, it's way easier to exercise if you're not in chronic pain. And please hear this point. You should not be doing any exercises that increase your pain when you have knee osteoarthritis. It will make your symptoms worse. It will make your osteoarthritis worse. It is very important that you have exercises that are specifically designed for you to help decrease your pain and increase your normal movement pattern. There's also some holistic things that you can be doing that we discuss here in the clinic a lot, which includes diet. Now, I understand I'm a physical therapist and I cannot make recommendations specifically regarding your diet. However, we know that if you have any form of arthritis, you have increased inflammation. So doing things like implementing a low inflammation diet will help to decrease your pain and your symptoms of knee osteoarthritis. It may even help other joints that are painful at this time. And another thing that you really need to consider, particularly if you're trying to avoid surgery for knee osteoarthritis, is it is entirely possible. I have seen multiple patients in this clinic who were bone on bone. It was proven on x-ray. The surgeon said the only way to become pain-free is to have surgery and have a total knee replacement. And I have successfully got them back to activities, including running, including hiking, including all the things that were important in their life, even kneeling to be able to do their gardening. So yes, it is entirely possible. However, you have to have a mindset that believes that it's entirely possible. It doesn't matter what clinic you walk into. If you walk in there with the mindset of the doctor says I have to have knee surgery and there's nothing I can do about it, I'm just here so you can prove me right, I guarantee you it doesn't matter how good your physical therapist is, they are going to prove you right. In fact, when I have patients who walk in here and they're like, I just have to do physical therapy before they're going to allow me to get surgery, then I don't treat them because I cannot help those people who have already decided that surgery is what they need. I wish them well. I hope that their surgery goes well. I hope that their recovery goes well afterwards. And if you need me after you've fully recovered from your surgery, I would be happy to help you at that point. However, nobody can change your mindset except for you. So if you truly believe that knee surgery is the only thing that is going to help get rid of your osteoarthritis, then I encourage you to pursue that path because that's the path that is going to work best for you. Everybody's different. However, if your goal is to avoid knee surgery and you want to know if having bone-on-bone knee osteoarthritis, if you can still get back to all the activities that you love doing without surgery, I'm here to tell you a resounding yes, you can. I have seen it hundreds of times in my clinic. You just need to find someone who can guide you through that process and do what your body needs to get back normal movement and strength to prevent knee osteoarthritis from slowing you down. If this video was helpful for you, give it a thumbs up. If you like this kind of content, go ahead and hit subscribe. And if you're looking for those exercises that I did to help increase my hip strength in preparation for the Dopey 2025, we're going to link that right over here.